Assalamu alaikum, Dr. Muhammad Amin, veterinary physician and surgeon. Today we will discuss about a very common field problem that is abscess formation in animals. Let's see general outline of abscess formation. What is abscess or abscesses? Abscesses are collection of pus in confined tissue spaces usually caused by bacterial infection. Symptoms include local pain, tenderness, warmth, and swelling. There are two types we will discuss further in next slides, and we will also discuss about treatment and the outcome of abscess surgery, etc. Etiology of abscesses. Numerous organisms can cause abscesses, but the most common is Staphylococcus aureus. Let's have brief introduction of Staph aureus. Staph aureus is gram-positive aerobic bacteria and it is catalase-positive bacteria. It can enter tissues by direct implantation, penetration trauma with a contaminated object, spread from an established contagious infection, dissemination via lymphatic or hematogenous routes from a distant site. Migration from a location where there are resistant flora into an adjacent normally sterile area because natural barriers are disrupted, like by perforation of an abdominal viscus causing an intra-abdominal abscesses. Abscesses may begin in an area of cellulitis or in compromised tissue where leukocytes accumulate. Let's define cellulitis. Cellulitis is an acute inflammation of superficial cutaneous or subcutaneous tissues. Mostly the most common bacteria are Streptococcus pyogenes and Staphylococcus aureus. Progressive dissection by pus or necrosis of surrounding cells expands the abscess. Highly vascularized connective tissue may then surround the necrotic tissue, leukocytes, and debris to wall off the abscess and limit further spread. Let's see what are the predisposing factors for abscess formation. Impaired host defense mechanisms like impaired leukocyte defenses, the presence of foreign bodies, obstruction to normal drainage, as in the urinary, biliary, or respiratory tracts, tissue ischemia or necrosis, hematoma or excessive fluid accumulation in tissue trauma. Tissue ischemia is the lack of supply of oxygen or and energy. Types of abscesses, there are two types: superficial, cutaneous, and subcutaneous, and second is deep abscesses. Uh, there is one term that is used in abscess, that is pointing of abscess. If superficial abscesses are ready to spontaneously rupture, the skin over the center of the abscess may thin, sometimes appearing white or yellow because of underlying pus. Let's see this picture. Here you can see that I have pointed out two main pointing uh, in abscess formation. Here you can see the skin is very thin and color is changed like yellowish or whitish. What are the complications? It can cause bacteremic spread, or rupture into adjacent tissue, bleeding from vessels, eroded by inflammation, impaired function of a vital organ, inanition due to anorexia, and increased metabolic needs. Diagnosis of abscesses, clinical evaluation, sometimes ultrasonography, CT scan, or MRI. Clinical examination mostly we use for cutaneous abscesses, while deep abscesses need some other aids like ultrasonography, CT scan, or MRI. Now we come to the main and important part of the presentation, that is treatment, or how can we deal with it. So surgical drainage or percutaneous needle aspiration and use of antibodies sometimes. Let's discuss the next slide, that we operated and drained out the uh, abscess. Let's discuss these steps. We washed the area antiseptically and gave stab incisions, drain out the pus, and washed with antiseptic solution, usage of H2O2, hydrogen peroxide, and then we put medicated bandage there inside for to stimulate the granulation tissue and avoid any pus formation and closure of wound. And then we use the antibiotics, some supportives, painkillers, and sets. So in supportives we used vitamin AD3. So what we have learned: cutaneous and subcutaneous abscesses are diagnosed clinically. Deeper abscesses often require imaging, usually drain the abscess by incision or sometimes by needle aspiration. Use antibiotics when abscesses are large, deep, or surrounded by significant cellulitis. And thank you for watching. I hope you will find the presentation useful for your practical experience.